My name is Richard Atwater. I'm an orthopedic surgeon at Northwest Hand and Orthopedics. Orthopedics is all about the restoration of function in the human body after illness or injury. One of the attractions of working here has been the speed with which patients can come in and see us. Many patients come in directly. They have a bone and joint injury or extremity injury. There's no 3-week wait to see an orthopedic surgeon in our universe. We can sometimes see them the same day or again within a few days. I decided to be an orthopedic surgeon because it seemed to me that compared to other specialties, they were having a lot more fun. I was looking for a practice where, as a physician, I could have a greater degree of control over the timeliness, appropriateness, and quality of care than I'd had in some other practice environments. I am a subspecialist in foot and ankle problems, and I've discovered that improving a person's ability to stand and walk is a big improvement in quality of life. I did a 1-year pediatric orthopedic fellowship at Children's Hospital in Seattle. I did that because I had been exposed to a lot of routine pediatric trauma, but not a lot of the long-term handicapping kinds of problems that children can have. When I have a new patient, I think my job is to find out what their expectations are, what they think is wrong with them. Then I need to get a good history and examine them and figure out what I think is wrong with them. And then I need to communicate with them and try to get a meeting of the minds about what their expectations are and what I can provide for them. Then we decide on a treatment plan and do it. You must enlist the willing participation of a patient in their care, or it's going to be a rough row to hoe. Even though you're a specialist, you're still, when you're taking care of a patient, you're responsible for the whole patient. If somebody has a heart murmur that you discover, your job is to get that evaluated and taken care of. If somebody has a malignancy that you discover, your job is to make sure they get into the right treatment program. There are several attractions about working in this kind of a setting. The doctors have an amazingly homogeneous set of expectations about how they're going to do things, and it's a shared set of expectations, which means that we get along, we agree on things a lot, but even more important, we have an opportunity to discuss things so that if we don't agree, we understand each other. I've worked in a variety of different practice situations, and one of the things that I firmly believe is that in smaller groups where you share a lot about your own practice and about other people's practices, you are less likely to have people going off on tangents and riding hobby horses into the sunset without any supervision. I think peer supervision is a critical thing in medicine. I have at times been an avid bicyclist, and my main extracurricular activity now is trying to learn languages and trying to learn how to dance.